Okay, joint restoration. Dr. Jeff Drazel Jr. here. I want to talk to you here at Innovative Medical Wellness on joint restoration. And what is it? Typically people like to get knee repairs, or don't like to get it. They end up getting a knee replacement. Why? Well, because somebody scoped it 15 years ago. The literature showed now that after you've had arthroscopic surgery to repair those meniscus, 15 years we're going to need a knee replacement. So there's so many regenerative approaches to doing this. And the specific one is, sometimes ozone is used a lot when we use the knee. And the main reason is with ozone is it's O3. When you drop an O, now you got oxygen. With the knee, we don't have as good a blood supply. So we want to oxygenate the area before we would try to put in a regenerative median. Typically, PRP, but a lot of the times when it's a knee, we might need to use biological allografts, which are derived from the stem cells, because there isn't a good blood supply. But a lot of other joints, specifically the shoulder, are quite simple to regenerate. Remember now, the shoulder is a very dynamic joint, and that's why it actually has a lot of issues, specifically to one tendon called the supraspinatus, and that's what most people know as a rotator cuff injury. Here we can truly treat this. A lot of the times we don't need to even inject with extracorporeal shockwave, with the proper fascial distortion model, with techniques like active release. These are certain chiropractic, physical medicine type approaches that can work. If not, we have our medical team here that can use a platelet-rich regenerative approach specifically on the tendon. We do usually when we're doing that, we're doing ultrasound guidance, but sometimes we will actually use video fluoroscopy when we want to go into the articulation, because video fluoroscopy is a motion x-ray. So come take a look at our office. We've got the most innovative approaches to fixing stuff, but we really do believe that getting a knee scoped is going to turn into a degenerative knee faster. All we're doing is taking away pieces and fragments, and now what happens when we take something away? We further accelerate the degenerative process. So please, if you're thinking about it, come see us. There's a lot of approaches before we do a simple arthroscopic, because yes, it is simple, but anything simple, sometimes there's complications too. And that might not happen right away. Generally, the science is showing in 15 years. So please come out. I want to make sure that you don't have a knee replacement in 15 years because you were scoped. Have a great day.